we've got one of the highest concentration of Category 3 hoods in the country. We're opening all of these now out for COVID-19 research.
In a high-security lab at Liverpool's School of Tropical Medicine, they're testing samples from doctors and nurses on the front line. This new style of test isn't for the coronavirus itself, but for antibodies people make in response to the infection. A positive result would show they're recovering and safe to return to work. It's made by Mologic, and it's one of the first prototype antibody tests to be validated as part of a clinical trial.
We need to be sure that these tests are both sensitive, so they're able to pick up everyone who's been infected, and also, importantly, specific. So we don't want the test to be positive when in fact they haven't been exposed to the virus. So it's very important to understand how the tests are working. If we're telling people that they've been infected and they're recovered, but in fact they're still vulnerable, they still don't have any immunity to disease, then that's going to be disastrous, especially if those people are frontline healthcare workers, for example.
So it's very simple, the process is very simple and very fast.
It takes just 10 minutes and it only needs a finger prick of blood. But unlike the current test for the virus, which only works when people are ill, the antibody test shows whether they've been infected and perhaps not even developed symptoms. It could prove crucial in controlling the pandemic. Loosening the lockdown would allow us to get back to work and lift the economy. But without mass testing, public health doctors wouldn't know how and where the virus was spreading. So this could be a game changer. The government has said it's buying 3.5 million antibody testing kits from different suppliers. But the chief medical officer has warned against rushing them out. A bad test is worse than no test at all.
We need to make sure that once these technologies exist, that we have the manufacturing capabilities lined up to produce as many as we can in the shorter space of time, but also that we have access to these technologies here in the UK, but also globally, especially in lowest resource settings.
The company hopes to make 8 million kits a year for less than £1 each, cheap enough to control the pandemic, even in developing countries. Thomas Moore, Sky News, Liverpool.